Hello, it's Stephen Del Jones, Doctor of Oriental Medicine at Tampa Bay AccuHealth and Spine. And today I want to talk a little bit about cardiovascular disease risk factors and certain lab tests that can be used in its evaluation and management. I want to emphasize, first of all, that half of all heart attack victims have normal cholesterol levels. So it's very easy to see that there's a lot more to consider in the evaluation of cardiovascular disease than just total cholesterol and HDL, LDL. So you need to understand that your overall nutrition status is directly tied in with certain key risk factors that affect cardiovascular health. So understanding your nutrition status and these other factors that are not commonly measured is very important. So when these are possible to be measured through what's called a micronutrient test and certain other lab testing that gives you a more thorough, comprehensive idea of where you stand in terms of cardiovascular risk. One of the first things that can be measured that is not normally measured under standard healthcare insurance is C-reactive protein. C-reactive protein is indeed produced in the liver, and it is a naturally produced substance, but it's produced in higher amounts when there's more internal inflammation in the body. So it is associated with a higher chance of heart attack, and it needs to be measured. It can be easily measured, although it's typically not normally done, but it is a very important factor. Nowadays, many people have heard of C-reactive protein. They're aware that it's an inflammatory marker, and it certainly is an important marker to consider. Another thing to consider is homocysteine. Okay, homocysteine is a metabolite of the breakdown of the amino acid methionine. So our body does, in fact, produce homocysteine naturally. The problem is that when our internal biochemistry is unhealthy, we tend to produce more homocysteine, and this excess homocysteine has damaging effects on the cardiovascular system. So it's very important to understand what your homocysteine level is. Incidentally, our body requires certain B vitamins and other nutrients to fully process and to properly manage homocysteine. So therefore, again, underscoring the importance of the micronutrient test, and so that you're able to see the behind the scenes, why is homocysteine high? Why is CRP high? Perhaps there's not enough vitamin D. Vitamin D is necessary to manage and control the CRP. Certain B vitamins to manage and control homocysteine. So understanding the correlation between your nutrition status and these inflammatory markers is very, very important. That's why we measure we do the micronutrient test, and we measure the CRP, and we measure homocysteine. Homocysteine is strongly associated with as a cardiovascular disease risk factor. Another cardiovascular disease risk factor is fibrinogen. So our body does produce fibrinogen, as it is important in the management of blood clotting. However, when fibrinogen is in excess, it does become a major independent risk factor for heart disease, for myocardial infarction, for heart attack, as it were. So understand that fibrinogen also can be measured. It's very important to make sure that that is not in excess, and that there are very distinct relationships between certain vitamins and some of these risk factors. So certainly you're aware that niacin is very important in cardiovascular risk management, but how are you familiar with your niacin level unless you have it particularly tested? So niacin, vitamin D, vitamin C, and other nutrients are very important in managing cardiovascular disease. But unless you know your personal biochemistry, unless you've had a test that you can really understand where you stand, you can't fully evaluate your strengths and weaknesses. And once you've had that, and you're armed with the information, you're able to determine what your strengths and weaknesses are, and you can make the best individual preparations customized to you and your biochemistry to protect against cardiovascular disease. If you have any questions, please contact us at Tampa Bay AccuHealth and Spine. And again, my name is Stephen Del Jones. You can come see me at the Salt Grotto Health Spa in Valrico, Florida, or contact us at Tampa Bay AccuHealth and Spine to find out more about specific testing for cardiovascular management. Thank you very much.